Bismillahirrahmanirrahim. Allahumma inni a'udzubika min azabil qabr wa azabi jahannama wa min fitnatil mahya wal mamati wa min sharri fitnatil masih dajjal. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. So let's start. Let someone's mic is unmute, please turn it off. Assalamu alaikum wa rahmatullahi wa barakatuh. We are starting our session today for the topic we are discussing today is going to be Islam, Science and LGBTQ+. And today we have part A, the intersex, the special ones. So this is a very important topic that we all should know about. We should have a complete knowledge of this topic from the scientific perspective and from the Islamic perspective, because this is something that is leading, the ignorance about this topic is leading to a real disaster. Our kids are really at the verge of a very big danger, very grave danger, and a major sin which is progressing in the society. And until unless we as mothers, as sisters, or as elders know the reality behind the two topics, the one we are covering today and the other one we'll be covering on Thursday, inshallah. Until unless we know the reality behind these topics, the real knowledge of Deen and Dunya both, we will not be able to guide our children about this. So that's why we have arranged this class, and I hope I'll try my best to explain both part A and part B in very simplified terms to you, so that you will be able to understand the core concepts of the intersex and the LGBTQ+ movement. So let's start our class. I've chosen ayah from Quran, from Surah Nisa, ayah number 1, in which Allah subhanahu wa ta'ala says, "O mankind, fear your Lord who created you from one soul and created from it its mate and dispersed from both of them many men and women. And fear Allah through whom you ask one another, and do not cut the relations of the womb. Indeed, Allah is ever over you an observer." So this ayah from the Quran, since Alhamdulillah, we all are Muslims and we believe that Quran is the word of Allah. It is the speech of Allah that Allah has sent upon Prophet, peace be upon him, and the Quran will stay there as a source of guidance till the end of time. So in this ayah, we clearly say that Allah have explained that he has asked the mu'mineen or the believers to fear Allah. Now, the first thing is to understand that fear of Allah, like the disbelievers say that Muslims have a concept that they have to fear their creator. And even the liberal Muslims, they have a concept that, okay, don't listen to the Maulvi or don't listen to the people giving dawah or talking about Islam, because they're always asking about fearing from Allah. So always remember that when we use the word fear Allah, or we use the word taqwa, the consciousness of Allah, it does not mean that we do not love Allah. Basically, if in a simple term, I would explain you what fear your Lord means is that if we look at our Father, I'm not comparing the two things, but I'm just giving you a simplified definition, that if we look at our Father, we love him and we fear him. There is a very respectful relation that if our father is at home, we would not do anything which we feel that if he might see us doing that thing, he would, we have a respect and we have a love. And that out of respect, we fear that if he might see us doing that thing, he will be angry at us, or he will, not talk to us. And it would be an unpleasant feeling for both the parents and us, the father and us. So likewise, there is a very beautiful relation between the creator and the creation. So Allah subhanahu wa ta'ala is our creator and he has created us. So when we say we fear him, it does not mean that it is out of disrespect. It is out of love and respect that we as Muslims fear Allah subhanahu wa ta'ala, because we don't want him to get angry at us. We don't want him to have a we don't want any kind of wrath of Allah over us. So when Allah says fear your Lord, it means that it is out of hope, love, and respect. It's not the fear from a tyrannical ruler, right? So Allah clearly says that he has created us from one soul, that is Hazrat Adam alayhi salam, And then from Adam, he created its mate, who is Eve. Eve alayhi salam, Hazrat Hawa alayhi salam is the second human being that was being created. And then from both of them, from Hazrat Adam alayhi salam and Hazrat Hawa alayhi salam, that was a pair. So from them, he spread it onward from that pair, male and female. So this is a very clear picture that a male gets married to or gets in relationship. Like obviously, there is no discussion about marriage at so far here, but there is a couple with a male and female, and they are a couple, and they produce male and female further. So there is no question about a couple being a male or a male, or a female or a female. This is very clear. All the religions believe in the fact that Hazrat Adam and Hazrat Hawa alayhi salam were the first human beings that were sent to earth. Hazrat Adam alayhi salam, Christianity, Torah, the Judaism, all the basic religions, they believe that Hazrat Adam alayhi salam was the first person to be sent on earth with Hawa. So this is a very clear picture that a male and a female join together and give birth to the series of the Bani Adam, or the mankind, which later on comprises of male and female as well. So I hope this ayah clearly explains that the creation of Adam, then the creation of Hawa alayhi salam, and then from them, from the couple, Allah spread it, men and women. Now let's come to the scientific perspective first. What we started in the ayah, let's look at the scientific perspective, and first we'll study the scientific portion of this, and then later on, inshallah, we will move to the Islamic portion. Now there is this heading of fertilization of human gametes. Gametes are basically what are gametes? They are the sex cells. That means that when a man and a woman have to reproduce, their body produces sexual cells. Sex cells are called gametes in biology. But if you understand it, if you just look at this picture, these gametes or sex cells are called egg in case of a female and sperms in case of a male. You can see that clearly in the picture. So this is the lady, this is the man, they got married, okay, and now they are producing, even before marriage, when a girl achieves puberty or a man achieves puberty, they start producing these sperms and ovum, right? But every month when the girls get periods, the problem is that the uterus is preparing the uterus is being prepared for receiving the baby, the zygote, which is formed by the combination of male and female gametes, right? So every month when the girl starts having her puberty and her periods, like at the age of 10 or 12, she starts having periods because every month the uterus is expecting a baby to be coming, and the uterus, thickens up its lining and prepares a very soft bed for the implantation of the baby. And once it waits for the baby, there is no baby. Obviously, we don't get a baby every month. So the uterus keeps waiting for the baby. And once there is no baby, then he becomes angry and he sheds up all its lining, right? The uterus, we're talking about the uterus. And obviously, when it sheds up its lining, the girl starts having periods. So this happens every month. But once the female gets married to a male and they have a sexual relationship, these eggs, which are formed in female body and mature every month, and the sperm in the body of the male, they unite. You can clearly see, and this process is called fertilization. The union, the physical union of an egg with the sperm is called fertilization, and the resulting product is called zygote. This, right? Okay, so zygote is the first cell that is formed by the union of male and female, the egg and sperm, and this zygote then multiplies and divides and forms the embryo, and then which later on grows and forms a complete baby. So this is the basic simple step. A girl and a boy, they are through their puberty, they are forming eggs and the sperms. Now one egg is, 2 or 3 or like a large number of sperms try to get inside the egg and fertilize it, but only one, mostly 99% times, one is successful in fertilizing this, getting into this egg, and a zygote is formed, and which later on develops into an embryo. So I hope this is a very simple slide and you can easily understand what's going on here. Now moving on to the next slide. So we know how a zygote, the first baby cell is formed, and that zygote multiplies and forms a complete baby. Now, what about the sex of the baby? how do we know that when a zygote is formed, it's a baby boy or it's a baby girl? So I hope some of you or most of you have heard about the chromosome, the term chromosome. Chromosomes are basically thread-like structures which are present in within each body cell of all the organisms, the living things, right? And chromosomes are the material which have a DNA or genetic material present on them, and through these genetic material, the characteristics or the traits are transferred from generation to generation. Like we say that if the father is dark in color, so obviously he will have kids, and father and mother, let's suppose, are dark in color, so they will have kids who are dark. Like Africans will obviously give birth to Africans, and similarly, Asians will give birth to Asian babies. Their the children will obviously look like their ancestors. So the chromosomes are those material which carry the genetic information, and they are responsible for the transference of different traits from the father to children, and from the children onward into the further offsprings. Similarly, the chromosomes are again responsible for a sex of the baby as well. So if we look at a male, the father has two types of chromosomes. One is X, like it's, the X and Y is just for the sake of naming. So one has X chromosome and one father has X and Y chromosome, right? And the mother has XX chromosome. So all the female in the world have XX chromosome, like this is the presentation for the female chromosomes, and the father or all the males in the world have XY chromosome. So if there is another X at this place, this means XX is a female. And if there is Y in this set, that means it's a male. So what happens is when the gametes, sperms and eggs are formed, the father produces two types of sperms. One type of sperms contains X and the other type of sperm contains Y, right? You can see in the picture that there are two types of sperms being formed in the body of father. One has X tag on it and the other has Y tag on it. While in case of mother, all kind of eggs formed within the body of mother have X and X because mother does not have any Y. So whichever form of eggs she's forming in the body, her eggs will always contain X. You can see here, right? So X and X. Now what happens is that now this X or Y will combine with this X or X. So let's see the possible combination. If this X combines with this X of mother, this will form 2X. That means the baby formed will be a baby girl, right? So 1X from father and 1X from mother will combine in the baby and form XX, which is a baby girl. Now, if this Y chromosome based sperm fertilizes the X chromosome based egg, you can see the zygote is getting an X from mother and a Y from father here. So when there is a total XY, that means the baby formed will be a baby boy, right? So this is a simple presentation that someone's mic is open, please mute it. So in case of father produces X and Y, two types of sperms, and in case of mother, wait. So in case of mother, she's producing XX, and now if the father fertilizes with the sperm containing X and the mother's eggs have X, the resultant baby will be a baby girl. And if the father fertilizes with a Y chromosome, the resultant baby will be XY, which is a baby boy. Now, in some countries, especially in developing countries and third world countries, the problem is that most of the people think that the sex of the baby comes from mother, especially in the subcontinent, but most of the, since they don't have knowledge, so they think that in case they want a baby boy, it is supposed to be coming from the mother. And you can clearly see that it's not the case. The Y chromosome is basically coming from the father. So basically, the father is responsible for the sex of the baby, because if Y chromosome does not come from father, the resultant baby will be a baby girl. So definitely it's a baby boy or a baby girl, that's completely the will of Allah subhanahu wa ta'ala. But again, some ignorant people think that the sex of the baby is dependent upon the mother. And you can clearly see that it's based on scientific proof that father is responsible for the sex of the baby. So if he donates Y chromosome based sperm, if Y chromosome based sperm fertilizes the egg, then the resultant child will be a baby boy. Now, this is one of my very favorite slides, and this is very simple and funny. I wanted to explain these steps, but I couldn't find anything better, any way better to explain this procedure through what we do in cooking. Because all of us are ladies, and we either cook or we have cooked something, made something in our lives. So I wanted to compare the cooking of the baby or the making of the baby with the making of some wonderful dishes that we have in our Eastern cuisine. So first, look at this side. I want you to understand this, and then we will coordinate this side with this side so that you can understand things better way. So when we want to, like, there is a dish called halim. Okay, I wonder if every one of you have tried it, but it's a curry, and basically it has meat and like lentils and salt, red chilies, and it's a very spicy dish, and it's a main course meal dish. So what you need for making halim is basically you need a recipe. That is the first thing that you need for making any dish, right? So we are comparing the boys with the salty dish, the main course dish, and we are comparing the baby girls with the desserts. Okay, so the next slide will be for the sweet dish. So for making halim, the first thing that you need is a recipe. Without recipe, you'll be unable to make halim, right? So this is the step one here, the recipe, and the recipe of the halim would be the basic thing. If you don't have the recipe, you will not be able to make a curry. The next step would be to collect your ingredients. So for halim, you need meat, you need pulses, lentils, and specific types of this and specific proportion of that. You would be needing salt and red chilies, and then the different types of the masalas and stuff. So it's a spicy dish, so you'll be needing all your ingredients. So the first step is the recipe. The second step is collection of good quality meat, good quality ingredients. The third step would be cooking, or the cooking process, or the making of halim, right? So when you cook something, obviously you put the ingredients step by step, and the ingredients have to be put while cooking in the right order. If you put something earlier or something later, that would definitely spoil the dish. Or sometimes if you don't fry the onion, or too much fry onion, or you burn the tomatoes or something, so obviously that will spoil the flavor of the dish. So cooking halim or cooking the dish is the third step. That even if you have a wonderful recipe, if you have wonderful ingredients, but if you don't cook it right, obviously the end result would not be really good. Now once the halim is cooked, then you take it out of the pot, and you place it in the serving dish. And then the final step would be the garnishing, which in case of halim, we put in green chilies, and we put on like we sprinkle ginger, julienne cutting ginger, fried onions, and then we have the very spicy chaat masala and stuff. So the garnishing is the final step, which you do before serving it in front of the guests. So let's suppose we have a party tonight and we are making a dish. Now let's come to this side. Now, since you have understood the cooking recipe and the stuff, so we will now see how this goes in cooking a baby boy. So the first thing is that at fertilization, when the sperm fertilizes the egg at the physical union of the male and female gamete, what is recipe is your XY male, right? So this XY is the recipe. This is the recipe through which you will be able to make a baby boy. If your recipe here is not correct at this stage, you will not be able to make a baby boy. So the recipe is the basic thing, that if it's XY, you are going to make a boy. And if it's XX, if your recipe is for a sweet dish, you ultimately, obviously, you'll be making a sweet dish. You cannot make a curry out of a sweet dish recipe. So XY is your recipe. Step 2 is your Like we say in halim, we had meat, pulses, and ingredients. So once you have the recipe, what you start accumulating or collecting is your ingredients. So the testes are the ingredients. So once the baby boy is formed at the single cell level by XY, now these cells multiply and start making a baby boy. And after few weeks time, the small baby boy, which is still looks like a piece of meat, would start developing spots and form testes within the abdomen of the baby boy, right? And the baby boy still is inside the womb of the mother. So the testes will form, and the testes are basically a good quality ingredients that you should have. Now, these testes, after you have good quality ingredients, will start producing certain hormones and chemicals, which will eventually form the external genitalia of the baby, which is like cooking process. If you have perfect ingredients, but your cooking recipe, your cooking process is not right, your dish will not be like you want it to be. So if the testes are perfectly fine, but the cooking process, that means that the hormones the testes are producing are not really good, or if they're not working properly, then that will ultimately affect the external genitalia that are formed in the male baby, which are basically externally, you can see that the male baby has a scrotum, and he has a penis. And obviously before birth, the testes descend just few weeks before birth, the testes descend from abdomen within to the scrotum, right? So this is the baby, and now the baby hair is delivered. Now, once the baby is delivered, obviously the nurse looks at the external genitalia and identifies that, okay, it's a baby boy or a baby girl. Just like when you serve halim out in the tray or serving whatever dish, then looking at the halim, you would tell that it's not a sweet dish, it's something spicy. So next, when the puberty arrives, this is where your dish has to be served in front of the guests. So when the puberty arrives, the male hormones are produced in the body of the male, and they give rise to the secondary sexual characters, which in case of male are formation, growth of the beard, the deepening of the voice, and similarly the bone starts becoming broad, like the jaw bone becomes broad and the pelvic bone becomes flat. And similarly, the muscle mass distribution changes from that of female. The male has generally more muscle mass, while the female has more component of the fats. And similarly, the ejaculation process and these kind of secondary sexual character, which are like a garnishing for the male. So anything that goes wrong or at the level of puberty, like here, if something goes wrong, is like if you don't put proper garnishing on your curry, then obviously it will taste fine, but it will not look really very nice or presentable. So similarly, if you're garnishing on the male, like secondary sexual characters are not properly developed, although he will be a male, but obviously he will be like a bit, feminish kind of male. So anything, if something goes wrong here, if the boy is not able to promote make proper male hormones, something goes wrong here, so secondary sexual characteristics would be delayed or maybe not properly evident, right? So I hope this slide is clear, and our curry is served. Let's move on to the Swedish. So kheer, I don't know if you've heard of it. Again, I was thinking of changing it to a bit English recipes, but then I like halim and kheer, so I preferred staying with that. So recipe for kheer. The first thing, now this is a female slide. We're making a Swedish, and here in this column, we're making a female baby. So in case of kheer, you have to have a recipe, obviously. You cannot make kheer without a recipe. So the recipe for the kheer, in step 2, you will be collecting the ingredients, which are milk, rice, sugar, and then few other things like vanilla essence and maybe, I don't know, Cura and stuff. So milk and rice and sugar, these are 3 basic components of this Swedish we are talking about. And then even like you have a wonderful quality of milk, and you have the best quality rice, and you have very nice sugar and stuff, then you start making kheer, and the cooking process is there. So if, however, you overheat milk, or you burn the sugar syrup, or you burn the rice, or you don't stir the liquid thoroughly, it starts sticking to the base. So ultimately your kheer would be spoiled if you don't cook it properly. It will either have a very burnt flavor within it, or it may not taste very nice. So once your kheer is ready, then here at this place where I'm pointing the cursor, At this place, you serve it out in the dish. And then ultimately, before serving it in front of the guests, you garnish it with almonds and coconut powder and raisins and etc. Like a lot of, the sweet stuff sprinkled on it. So this is a perfect recipe for your kheer or your Swedish. Now, again, let's trace this back here. At fertilization, the father is donating one X and the mother is donating one X. So this is XX is the recipe for forming a female baby. So if you have a recipe of a double X, that means you will be having a baby girl. So this is the basic recipe. If something goes wrong in this recipe, your recipe is not right, obviously you will not be able to get a perfect baby girl in the end. Similarly, excuse me. Similarly, now let's look at the ingredients. Once the XX chromosomes are formed in the baby, and now these cells multiply and divide and start forming like a piece of meat, a bigger piece of meat. The baby develops. Now we're talking about the baby girl inside the womb of the mother. So the baby starts developing spots, and then ultimately, which give these spots convert into the ovaries and the uterus within the baby, within the womb of the mother. So these ovaries and uterus, once they are formed, they now start producing hormones or chemicals, which obviously is like a cooking process. You have wonderful ingredients, and now you need to cook, or you need to these ingredients to be blended or mixed up properly to give rise to the ultimate kheer. So if your ovaries and uterus are producing hormones and these are working very well, they will be able to form the external genitalia for young baby girl within the womb of the mother. And these external genitalia, in case of females, we all know that there are certain parts of female genitalia which are called labia majora, labia minora, and then clitoris and vagina and stuff, right? So these are the perfect, when the ovaries and uterus are perfect, their hormones are, and the chemicals they're producing are perfect, and the hormones are acting on the right spots, the receptors are responding, then the external genitalia formed of the baby are perfectly fine. Now here at this place, your kheer is served in the dish, that is your baby is born. And now when puberty arrives, the female hormones kick in, which are like estrogen, and these hormones give the secondary sexual characters to girl, like growth of breast tissue and the menstrual cycle. The voice becomes like high pitch. Similarly, the fat distribution in case of females, the quality of skin, it becomes very fine and delicate. There are more hair on the head and less hair on the body. So the function of the female hormone is to have thicker hair on the scalp and less hair on the body, while the function of the male androgen male hormones is that male hormones decrease scalp hair and give more growth to the body hair. So if in case we have heard that in case of polycystic ovaries, there is a problem with the female hormones, the female sexual hormones. So that's why when we see girls who have polycystic ovaries, they have secondary sexual characters in which they start growing beard, because there is problem with the female sexual hormones at puberty. So they start having hair fall. They have most of the patients who come to me for laser, they have beard like hair, and they have male pattern of distribution on their of hair distribution on the body. So this means that during all these steps, if your recipe is not okay, if your God forbid, the recipe of the baby is not okay, or the ovaries uterus are not properly formed, or if the hormones they are producing, they are not working properly within the womb, then the external genitalia might be corrupted. And even if everything goes well and the baby is born here and your nurse is looking at the baby and she's telling you that, okay, you have a baby girl, but if there is some disruption at the level of female hormones at the time of puberty, then obviously the secondary sexual characters will be affected. But again, we will look at these problems individually in the next slide. So I hope these two funny slides have cleared the concept of what goes on right from the start of conception up till the baby is born, and then later till the time they have puberty. Now we'll look at the problems at each step individually. This is a complex slide. If somebody is into science and they have studied statistics or something, they can study it later in the detail. But for the others, I would just simply go through it. so as not to confuse you all. So sex chromosome problems are the recipe problems. Now we see that the first thing that we encountered in the previous two slides was that you have to have a right recipe for making the right baby, or right, the curry and the meat, the dessert. So if the recipe, the XX or XY is not right, then obviously everything would be disturbed. So once in a blue moon, rarely, this happens that more than one the sperm fertilizes the egg. So what happens is that the resulting pattern could be instead of XY, it could be XYY, which is called Jacob syndrome. It could be triple X, trisomy X. This could be like two sperms containing XX would have fertilized the the egg from the mother. In case of Klinefelter syndrome, there are double XY, like this third one. You can see, yeah, here. So this is XXY. So probably this X has been fertilized with two sperms with XY, or maybe at the level of formation of gametes, the egg or sperm would have not broken down into X alone or Y alone. The kind of, if somebody has studied mitosis, meiosis, so in formation of meiosis step might be some problem, or it could be XO, this is called Turner syndrome. But in any case, if there is a problem in the recipe, let's jump here. We see that the incidence is low. It's not very common. It's 1 in 3,500 female births, 1 in 1,000, 1 in 1,000. But you can clearly see that the treatment specifically involves special education and support. Like in every case, you can see that these children they have a problem with their IQs, and they really need special education. They cannot work or survive on their own alone. They do need assistance, they do need guidance and special education. So these people who have the recipe problems at the basic level of chromosome, genetic level, they cannot go out in public and raise a voice and be part of a protest or something. These are very innocent people, and these are they don't actually know the evils going on in the world, and they have their own mindset. They need special education and support to be healthy and functional, right? So you can study this slide later on. So this is basically problem with step one when you come across people with recipe problem, that is problem at the level of sex chromosome. It's just like you've heard about Down syndrome and these kind of other problems in which there is IQ problem, there could be mental retardation. But again, these people are special people, and they cannot be wicked because they don't understand the hidden agendas of the people, and they cannot be part of it, right? So they are very innocent and they're very special ones. Now, there is one thing we have all heard about is that birth defects. What are birth defects? Birth defects are the structural abnormality of any type that is present in birth, and it could be apparent, as we will see in the next slide. It could be apparently not visible, but may present as a symptom of something, and then later on when we do the test, we find some problem with the internal organ related, or there could be a missing of a vital hormone or enzyme, like in case of digestion, or in case of certain hormone making or certain enzyme making. There is a critical, very small catalyst that might be missing at the level of microscopic level, or at a biochemical level. So birth defects could be like very evident in front of your eyes. It could be hidden within the body, or it could be at a molecular level, which you will not be able to see until unless you get some chemical tests done. Usually week 12 to 20 is the time where the external sex organs can be traced on the ultrasound. So ideally as early as 12th week, and but usually at the 14 weeks, they start becoming more clearer. But usually from 12 to 20 is the time period that the doctors who do the ultrasound can see the external genitalia of the baby, and they can see what is the sex of the baby. There are various blood and scanning tests available to screen for possible birth defects in babies before and after birth. Even before birth, there are different kinds of ultrasound available, colored ultrasound, different kind of the blood sampling and the amniotic fluid sampling and other types of sampling, which could help parents identify different kinds of diseases like even thalassemia traits and stuff. So before and after birth, now science is, alhamdulillah, develop enough and advanced enough to diagnose these kinds of birth defects. Various countries where parents are eager to know about the sex of the baby, resulting in abortions of baby girls, especially in case of subcontinents where everyone wants to have a baby boy, the government has made it punishable offense to inquire about the sex on ultrasound. Now, this is in especially in case of I guess India and few other countries. Their government has specifically made it a criminal offense to if parents ask about the sex of the baby, or if the doctor tells them about the sex of the baby, because it might result, in case of baby girls, it results in abortions. So that's why the government has kept a heavy penalty for this. Now, what could be the causes of birth defects? We know that there is a system that Allah has made, and it's running smoothly since like billion of years, ever since Adam and Hawa, and things were not really getting worse. But with time, we see that the things are slipping off from the hands of humans. As we are getting advanced, we are discovering new treatments, but again, there are new diseases, there are new problems coming up as the science is growing. So what could be the causes? The first cause is the chromosomal abnormality, like we discussed, that in sometimes two or more sperms could fertilize. Sometimes there is a problem in formation of gametes, and sometimes in case of meiosis, the cells do not produce gametes with half number of chromosome. Again, it's a bit a scientific level thing. So chromosomal abnormality could be possible. And even sometimes we hear around us, we come to know about people who have recently got married and they're pregnant, they're very happy, and then after 2-3 months of pregnancy, we get to know that they have a miscarriage. So this is the natural thing. This is how Allah protects us, that most of those miscarriages are due to some chromosomal abnormality, and the nature actually filters those babies instead of those babies becoming a proper human being and giving birth, and then later become a trial for the parents. Naturally, those babies are filtered and results in miscarriage. So most of the time when this happens in early first trimester, in the first month or second month, or before actually the third month end, if somebody has a miscarriage, most of the time it's due to the chromosomal abnormality. Now, number 2 is a developmental defect, such as mother having some tumor secreting hormone or underlying disease. Now, developmental defects such as mother, like if mother is suffering from any disease like a tumor that is secreting an very high concentration of male hormone, that hormone will definitely affect the developing baby. So if mother's health is not okay, if she's suffering from some underlying disease, that would definitely give problem to the formation of baby and its growth and its proper development. So obviously, if mother is not okay, the baby might develop some birth defect. Number 3 is synthetic hormones given to prevent abortion might result in malformations. So sometimes in case of even malpractice, sometimes doctors don't know much about the side effects of whatever they're giving to their patient, and sometimes as a side effect, rarest side effect, these hormones which are given to prevent the abortion might result in the malformation. So that's why the doctors have to be really they should know what they are doing. So and specifically the new drugs coming over in market slowly and gradually, every 3-4 months, 5 months, we could get to hear that there is a new research and this new drug is out in the market for XYZ reason. But the problem is that problem with science is that after 20 years, you come to know that, okay, that drug that used to be used for certain disease at 20 years back or 30 years back, the next generation who came afterwards had these side effects due to that medicine being used 20 years back or 30 years back on the mothers. So synthetic hormones or such, the artificial hormones may have this problem of birth defects in the children. Number 4 is infections such as measles, rubella, herpes, HIV, which is AIDS, hepatitis, etc. in pregnancy. So again, that's why mothers have to be very careful while they're pregnant. They should not visit people who have these problems. like rubella, some patient is suffering from rubella or measles, and they go and meet them. It's better to stay away. Just call them, give them a phone, and ask them about their health on phone. Do not just stay away from these kind of infections. If the mother is suffering from AIDS, obviously she has her immunity completely suppressed. So that's why obviously baby can have birth defects. Similarly, some kind of hepatitis are transferred from mother through her blood into baby, and that could result in problems in the baby. Number 5 is harmful medicines such as aspirin and sleeping pills, etc. These are the over-the-counter available drugs which are easily available without prescription. And most of the time, when women have some problem in pregnancy, such as headaches or body aches or coughing or flu, they would or ask somebody to bring this over-the-counter medicine for them, and they would self-medicate themselves. So these, always remember, aspirin is very notorious. You should never use aspirin in your pregnancy, because aspirin is known to cause heart defects in the baby. It can cause what we call as hole in the heart. So aspirin and sleeping pills and such kind of medicines should be avoided, and you should stick to organic, the Eastern grandma's remedies. Totke, we call it in India, Pakistan, for the solution of such, if you are having headache or something during pregnancy, stay away from the medicines. Similarly, chemical and radiation exposures, such as too much use of especially the people working in the environment where the excuse me, the X-rays or the ultrasounds, or the radiations are a lot. If some nurses or some pregnant doctors are working in that environment, they should be very cautious about it, because extra chemicals and radiation exposure can give rise to the birth defects. Similarly, alcohol, drugs, smoking, or living in heavily polluted cities. Now, obviously, we know alcohol is generally harmful for the body, and of course, it's harmful for the baby as well. Similarly, mothers who are on drugs and smoking, and even if their partner, if the father is smoking and the mother is sitting in the room and she's passively smoking, she's not actively smoking, but if she's inhaling the smoke, the overall the carbon emission and the stuff from lighting a cigarette, she's inhaling that, obviously that will harm the baby. Similarly, if there is a heavily polluted city air and mother is breathing in it, like most of the time, even in Lahore, we have a really bad scenario of air quality index these days. So this heavily polluted air is obviously harmful for the developing baby. Number 8 is beauty products with retinols. So tretinoin, retinols, or vitamin A is strictly contraindicated in pregnancy. It's teratogenic. It will cause massive fetal developmental abnormalities. So do not use beauty products with retinols, retinoins, vitamin A. BHA is beta hydroxy acid, in which there is salicylic acid. Again, salicylic acid is aspirin. Similarly, anti-acne treatments, whitening treatments. So just stay away from these things while you're pregnant. It doesn't matter if you look good or bad in your 9 months of pregnancy, because these 9 months will determine the life and health of your baby for the rest of their lives and your life. Number 9 is mother's age is very important, such as in Down syndrome or congenital problems running in the families. Mother age is very important. So because the chances of Down syndrome increases as the mother age crosses 40. So as if she's 40 plus, then obviously the chances of Down syndrome and such problems increases. Now, this picture gives you just an overview of birth defects. You can see in the first picture, we have a heart, and you see this is the side of the heart. This is the left side of the heart, and it is basically, sorry, this is this heart, and you can clearly see, let me find my cursor. You can clearly see there is a mixing of the good blood and the bad blood, the oxygenated and deoxygenated blood, and there's a hole in the septum of the central partition of the heart, due to which there is mixing of the good blood and the bad blood. So what happens is that the child is born, he or she is normal, but after some time the mother starts noticing that when he or she cries, he or she turns blue. So this is obviously upsetting, and proper blue, like not some lab, just a tint of blue, proper blue. So they take the baby to the hospital, and the doctor knows that there's something wrong with the heart, and then they perform their test, and they come across this situation where there is a septal defect in the heart, which is in layman terms called hole in the heart. Similarly, in the second diagram, you can see the baby has a congenital club foot. It's like those who play golf, they have their club in the form of this. It's twisted at the ankle joint. Then we know so many people around us have milk or lactose intolerance because they lack an enzyme for the digestion of the sugar of the milk, which is lactose. So the enzyme that digests is called lactase, and they are lactase deficient. They do not have that enzyme. So once the baby starts feeding, the mother starts complaining that the baby vomits the milk bag, or complains of starts crying, feeling bloated, and have stomach which is very tight. So then the doctors perform test, and then they know that the baby is lactose intolerant. Similarly, this is called cleft lip and cleft palate. So in cleft lip, you can clearly see the baby's, this palate has two sections of bone that from both sides come and join in the center. And now the center is like, it's not properly joined. So the palate is open from mouth into the nasal cavity. And similarly, the lip is also cut like this. So this is a surgical problem, and alhamdulillah, the doctors have a treatment for this. They will operate this baby and get this thing repaired. In case of this, you can see this is called polydactyl. That means there is an extra digit form. So we all have 10 digits, but such kind of people have an extra thumb or extra small finger. And this is called polydactyl. If somebody wants to get it fixed, they can simply get a surgery done and get this extra thumb removed. This is called duodenal atresia. Duodenal atresia is basically a congenital malformation in which the stomach, when joining the small intestine, have a problem. There's a twist over here, twist or completely blockade of the passage. So when the baby takes milk, the milk is not, it cannot pass from duodenum to the small intestine because this area is completely blocked or partially blocked. And that's why the stomach starts swelling. The baby, you can clearly see the baby's stomach bloated up, and the baby ultimately vomits back. So the doctors know that they get a barium swallow or something like that done, the different test, and then they operate it and open this pathway. So these are the kind of the birth defects that you usually come across. Now let's come to our topic, which is intersex and hermaphrodite. Why I taught you so many slides before this topic was because if you don't know about what was happening at the level of the recipe, ingredients, and cooking, and all that those funny slides I showed you, you will not be able to grasp the concept of what's wrong with these people. So intersex is the medical term. Intersex is basically the term that you will come across in all the literature and in all the scientific studies. There is also another term which is called hermaphrodite, which is used, but technically speaking, hermaphrodite is used more in biology. Rather, it's basically it's used for animals and plants more. So that's why it's not really a very nice term to define a human being. But again, since we are studying the topic, so I wanted you to know both the terms, the intersex and the hermaphrodite. Hermaphrodite are the species, both in plants and animals, which have male and female combined within one individual. Like earthworm is a hermaphrodite. Then we have some plants in which the flowers are hermaphrodite, and they have male and female sexual organs both in one flower. So they are called hermaphrodite, but in humans, we prefer to call them intersex. So what's wrong with hermaphrodite or intersex people is that they have problem with the ingredients. Remember the ingredients for cooking, or the cooking procedure problems. So either they have problems with the ovaries and testes, or they have problems with the functions of those ovaries and testes for the formation of the external genitalia. So children having abnormality at birth, which results in sexual ambiguity once they are born, the nurse or the doctor is unable to tell the sex of the baby just by looking at the external genitalia, because the sexual genitalia are ambiguous. They are not very clear. These are called intersex or hermaphrodite babies, and there is a difference in the intensity of such cases. It could be a very simple, minor case, or it could be very advanced and a very difficult case. The intersex birth is a medical condition that falls under the section DSD, which we call as disorders of sexual development, and its rate is approximately 1 in 5,000 birth, which is very low, which is actually 0.02%. Now, there are two types of this. The intersex that usually we discuss is of type 2. The type 1, which is true hermaphrodite, is very, very extremely rare, as we shall see. So we have two types of this intersex problem. One is called true hermaphrodite, and the other is called pseudo hermaphrodite, as we will see in the next slide. So true hermaphrodite is the real hermaphrodite. True means obviously real. And with the true hermaphrodite, we have problem at the level of ingredient, basically. Like we said, that if you are making the halim or the kheer, the curry or the sweet dish, and you mix up the ingredients. You have a party tonight, and you are planning to make a sweet dish and a curry, and you accidentally mix up the ingredients. So what will happen is that you replace salt with sugar and sugar with salt. Obviously, your curry or your sweet dish would be like with a twist. It would not taste like that, and it would not appear like that. So a true hermaphrodite is a person who have ingredient problem. What is ingredient problem? It means that the one has gonads. Gonads means the sexual organs, the internal sexual organs, and the genitalia. Genitalia is called, it's the medical term for the external sexual organs, and gonads are called the internal sexual organs. Like in case of male, the gonads are testes, and in case of female, they are ovaries. So what happens is the true hermaphrodite is a person who has the internal and external sexual organs of both genders. So both are mostly ill-defined. They are not properly developed. Like a true hermaphrodite does not have true complete true testes and ovaries. Either they have remnant of ovaries or testes, both like a ill-developed, ill-defined tissue, or they might have one major one, like either one testis and the ovary is rudiment. It's a kind of mixture, like problem with the ingredient level. So in their case, both ovarian and testicular tissue is present. It might be fully developed, but both will not be fully developed. It might be one of them is fully developed and the other is regressive, while it might be a fact that both of them are completely rudimentary, right? So they might have, externally, if we look, they might have just a hole in the front and in the back, or they have vagina and penis like structure, like not the complete vagina and penis both, but they have either vagina, complete one, or penis not fully developed but half developed. So it's a very confusing situation. And they have these kind of structure both in the same individual. It is the rarest disorder, making about 5% of the DSD, which is equal to 0.00001% of the total births, which is like 1 in almost 10,000 births. So it is the rarest disorder that this thing happens, that a baby is born with a completely ambiguous genitalia. You cannot exactly looking at the genitalia identify. And when we perform different kind of tests, then we see that, okay, one testis is there and there is like a very rudiment, the withered ovary, or one ovary is there and there is a mark of testis, slight testis, or there is no external genitalia, there are just holes. So this is the rarest form of intersex that we come across. It's very rare. So this is called a true hermaphrodite or the real intersex, right? The second category is called, just for the moment, ignore the picture that I have put. This one, just ignore, just look at the text here, and then I will explain you the picture later on. So pseudo hermaphrodite, while the pseudo term is, whenever you find this pseudo term, it means false. Okay, so false, pseudo means false. So the first type was true hermaphrodite, the second is now pseudo hermaphrodite. Pseudo hermaphrodite are the people who have unambiguous genitalia. They do not have ambiguous genitalia. So what happens is the ingredients are fine. You have proper testes, you have proper ovaries, but the cooking process has some problem. So what happens is that it is a condition where the genetic sex XX or XY is same as that of the internal gonads. Like genetically they are XX or XY. They have, according to XX, they have ovaries, and if they have XY chromosomes, then they have testes. So your recipe and your ingredients are perfectly fine, but the problem is with the cooking. What happens is that the external genitalia are different. So the baby have perfect recipe, the baby have perfect ingredients, but the cooking process has been problematic somehow. So in case of female hermaphrodite, we say that there are double X chromosome and there are ovaries present inside the body, but the external genitalia looks like male. In such cases, this is there is a disease which is called, you can see I have written it, CAH. This is congenital adrenal hyperplasia. CAH in general term is called. It's 1 in 14,000 birth or 0.007 birth. What happens is that when the baby girl is inside her mother, if the mother has a tumor which is secreting male hormone, now obviously the baby is getting the blood from the mother. So if mother has a problem of a tumor which is secreting male hormone, that male hormone from the mother will come and act upon the female genitalia of the baby. So you can see normally the female baby would look like this from outside, and internally you will see this is the urinary bladder, and this is the uterus, and this is the vagina. So what happens is, if there is a small tumor in case of mother and secreting a low quantity of male hormone, then what will happen is that the clitoris, this is the front small, there is a tubercle type thing which is called clitoris. So it will just be slightly enlarged, and you can see that the urinary tract opening, the urethra is separate and the vagina is separate. If the problem persists and the mother is secreting a increased quantity of male hormone, then the process is called virilization. Virilization means turning the female external genitalia into masculine one, like the male one. So if again mother is secreting high quantity of male hormone, the baby's the baby's external genitalia, internally her ovaries and uterus will be fine, but just the external genitalia will stage by stage, if there is too much external androgens from mother, then of course the external genitalia, instead of responding to the ovaries inside the baby, they will respond to the male hormone secreted by the mother. So the external genitalia will start looking like that of a man. So when you can see in this case, you see even the opening has become joined. The vagina is joining with the urinary bladder opening here. And the clitoris has increased in size and a bit outgrowth like this, phallus increase, right? So in stage 5, you can see that there is no testes over here. There is nothing. There will be proper ovaries, but externally the vagina has been closed, and this won't be a proper penis, but it will be an outgrowth. And you see that they don't have any vagina here. So this is the extreme condition. Similarly, in case of another disease, like in adrenal hyperplasia, what happens is that the baby have a small adrenal gland over the top of the kidneys. So the adrenal gland of the baby starts secreting certain chemicals or hormones that affects the external genitalia. So again, these types of problems at the level of cooking. The problem is at the level of developing. So once these babies are born, the doctor know that there is something wrong, because either they have one opening or they have two opening, but then the externally genitalia is looking like this. So the doctor rush them, the pediatrician or the neonatologist will rush them and scan them and get an ultrasound done, and they will find a uterus and the ovaries. So all these things are treatable. You don't have to be worried about it, because these things are, alhamdulillah, treatable in combination with hormonal therapy and surgical correction. But again, people should know that these are treatable. If they don't know it's treatable, of course, they will spoil their life and their children's life. Similarly, in case of male pseudohermaphrodite, we see that there are XY, the recipe is fine. We see that XY chromosome is present. Similarly, we see that, in this diagram, if you look at here, these are the testes. They are present in the abdomen. When the baby is about to be born, the testes descend into scrotum. But in this case, this is called testicular feminization syndrome. in this case, what happens is that your ingredients are fine, the testes are there, but the hormones the testes are producing, which when the baby is inside the womb, should come and work here and help the formation of the scrotum and the penis over this area. But if the hormones from the testes are not working properly, or if this area is not responding, like if you order your maid to wash the bathroom, and she doesn't take the order, obviously the bathroom will stay dirty. So if your testes are ordering for the formation of scrotum and penis, but your this area is not responding, so automatically the ingredients are there, but the cooking procedure is not right. So in such cases, when the babies are born, she will not have a vagina. She will look like a girl. And originally, when the doctors will palpate here or here, they will feel that testes are there. So again, this is fixable, treatable kind of condition, and it is rarer than the female variant. It is very rare. So the undescended testes can be palpated in lower abdomen, close to the external genitalia, and there are no ovaries, and they might have a small blind vagina, but there are no ovaries, no uterus, as doctors can easily trace this on ultrasound. Now let's come on to Islam and intersex. Now, what does Islam say about it? Previously, we have studied about the scientific thing, and now we'll study about the Islamic perspective about it. The word hunsa or intersex, hunsa is used. Whenever you study Islamic literature, you will find hunsa word, which is used for intersex. It is derived from a root referring to softness, gentleness, the kindness and the delicacy or tenderness. So now we have studied, whatever we were studying was from science. We know that Islam, more than 1400 years ago, before all these advanced procedures and scans and the scientific tests that we can do today, it's laid out principles to sort these things out, because we know that Islam is a religion of Allah subhanahu wa ta'ala. It's basically since Allah has made us, so how can Islam not tell us about something which Allah has created? So what happened was that these kind of intersex people or birth defects were even present at the time of Prophet, peace be upon him, and even before that. So the scholars, as per the the fiqh scholars, they have derived different rules as per the incidences that took place at the time of Prophet, peace be upon him, and the Khulafai Rashidin, or the four rightly guided caliphs, and they have laid down a principle to identify such kind of people as to be either they are male or female. So what happens step by step is that if the masculine signs are dominant in such individuals with the ambiguous genitalia, then we classify them as males. Now, what are the masculine signs? The first sign is the presence of testes in scrotum or in abdomen. So the mufti or the people who have knowledge about these things, they will, if it's supposed to be a male, the male will palpate the abdomen and see if they can find testes in the abdomen. So if there are testes in the abdomen, obviously he's a male. And then obviously you will take them to doctor and discuss with them what to do with the testes, because if the testes stay there for a long time and they are not treated for this, the testes might develop different types of cancer in it, right? So the first sign is to see the presence of testes in the scrotum or abdomen. For we are studying the masculine signs. The second sign is urinating from male organ. So if the baby is urinating from the male organ, like we saw in the 2 slides back, that sometimes if the female is being born, but internally she's a female, externally she's looking like a male, but she will be urinating from urethra, right? So if the baby has 2 openings and the baby is peeing from the front opening, it's a male. If the baby is peeing from the back opening, it's a female. If somehow the baby is peeing from both openings, then the criteria is to see which opening is giving out more of the pee, right? So it's a bit technical. Again, not everybody can diagnose it, but we have to have specialized people in fiqh and sharia to rule these things out in case there is no doctor available. Now, the third thing is if like in childhood, you are unable to diagnose that it's a baby boy or it's a baby girl. There are like you in case of true hermaphrodite, it's very difficult. So then you wait for the puberty and you see the growth of mustache and beard. If there is growth of mustache and beard, that means it's a boy. So if someone comes to you with lipstick and makeup and have a beard and mustache, just know that they are males. They are not intersex. Okay. That obviously we will discuss about this in our next class. Then the last point is ejaculation, the wet dreams. Obviously, if somebody is a male, they will have this quality. And if one of these or all of these are present, then the ruling for men is applied on him, right? So this is a simple way to, in case of Sharia, to diagnose if the intersex is male or female dominant. He should dress up and behave like man in every aspect of life, and all the rules of Sharia, including laws of inheritance for that of male, are applicable on him. So Sharia doesn't leave, even in case of ambiguous genitalia or in case of intersex people, they are bound to take one side. As per the dominant sex present in their bodies, they have to define themselves male or female. They cannot go out roam with with the beard and then the lipstick. This is completely forbidden. They have to go see a mufti or they have to go see a doctor, and they have to evaluate the dominant sex within them, and then dress up and work and perform their duties and have their rights according to the male or female, whatever sex is dominant in them. Now, if somebody is there, if a baby is there who has female signs dominant, such as presence of ovaries and uterus, this is very easy to see these days because we can simply do an ultrasound and we know. Presence of vagina. The third criteria is if she's urinating from the female urethra or from the posterior opening. She, in case you are unable to find out, and then she grows up, and once she has puberty, then menstruation and enlargement of breast. Similarly, with the female pattern of hair on the body is different for males and females. So these are all the signs which can be evaluated based on the knowledge of fiqh and Sharia, or obviously the medical science is very advanced. So this is very easy to evaluate if some baby with ambiguous genitalia is a male or female these days. It's no more a problem. It might have been a problem 1400 years ago, but even then Islam completely had solutions for that even at that time. And it's way more easier now to diagnose these things and to help these people become part of the normal functioning society and to have proper rights and duties performed in a Islamic Sharia way. So such women have the rulings for women applied in every sense, and she should completely dress up and behave like a woman, and she should observe her hijab, and all the rights and duties of the women will be applied to him or her on her. If nothing or all of these symbols happen, then hermaphrodite will not be assigned a gender. So rarely, very rarely, if even medical science and Islam says that, okay, there is everything is 50-50. There is no diagnosis about the dominant sex present, then this person is termed as hermaphrodite difficult or true hermaphrodite, or in Islamic literature, we called her or him Hunsa Mushkil, right? So these are the people who have, the Islam or science do not finally, diagnose their dominant gender. And such kind of people have this, again, it's a kind of trial, just as we see that in kids who have a hole in the heart, or with kids with Down syndrome, or with kids with mental retardation, then this kind of the Hunsa Mushkil is kind of, you can say, a trial from Allah subhanahu wa ta'ala for those people. In case of ambiguous genitalia are not cleared in childhood, then the scholars have suggested to wait till puberty as secondary sexual characters, like we study, that they will have either menstruation or development of mustache, or the development of breast and stuff. So they can help with the final settlement of the sex. In current era, modern science has various tests that can be done at genetic level. So we have DNA analysis now. We can simply check somebody's DNA to see if they have XY or XX recipe. So this is very simple. Now we have ultrasound, we have MRI, and such facilities are available before birth and after birth to help diagnosis and treat such physical problems. And a group of doctors is basically assigned to such children, in which there are doctors from medicine, surgery, gynae, neonatology, and then psychologist and endocrinologist. Like, it's a team of doctors who work together for such kind of babies, so that they can become a normal part of the society. They can lead a healthy, normal life without any psychiatric problems and without any physical or hormonal problems. And even, when we see that in case of archaeological sites, when different, the graves are dug, or we find skeletons of, 200 million years back, or different mummies like we found in case of Egypt, we see that very clearly that just by studying the bone structure, just by studying the hip bone alone, 95% accuracy is there to find out the sex of the skeleton. So this is very simple. This is very easy now. It's completely not. It's not at all difficult to diagnose the sex of the baby or a person now with such advance. Even just looking at the skeleton, you can tell if it's the skeleton of a male or a female. Now, what could be the side effects? Let's see. In the basic side effect is again due to lack of knowledge and ignorance. So, in case of ambiguous birth, parents, if not informed or counseled, might give away their children, being ashamed of them. This happens most of the time, as it happens in home deliveries in rural areas, because obviously they don't know there is a lady who is doing the delivery and performing all the work. She's not very educated, so she just tells that, I don't know, it's a baby boy or a baby girl, and it's with ambiguous genitalia, so I think you should just might give the baby away to people who are involved in this kind of business and the criminal things and stuff. So such individuals, if treated properly, can become healthy part of society and live a normal physical and social life. So if the parents don't know, or if they're shameful of that, and if they are not properly guided, obviously such individuals who can become perfect human beings, who can become a healthy part of the society, they will be left alone or given away to different people who are working for evils in the society. They will become either beggars, or they will become sex workers, or they will be involved in drugs and all kind of evil acts. So if left untreated, such people develop different types of medical complications. Like we talked, if these individuals are not treated properly, they might develop cancers of various types related to their underdeveloped sexual organs, or increased compensatory response producing other hormones, which are generally kept in check. So obviously there is something wrong going on in the body, and if you don't fix it, that could cause in trouble. Even in case of, we see that people who have gallbladder stones in their gallbladder, and they don't get it treated. There are scenarios that those stones have converted the they have really harmed the gallbladder, and gallbladder has developed a cancer, and then that spread to the liver cancer. So again, anything which is going wrong inside the body has to be fixed, because if you don't fix it, it might turn into any form of disease. Similarly, third side effect would be in case of mismanagement of intersex people. These are either castrated, if somebody just gives them away to these criminal-minded people. So what they do is they castrate them, or give them coax treatments to become part of large community involved in all kind of illegal activities such as prostitution, beggary, drugs, and human trafficking. So obviously this ruins completely the life of that individual who could have been a normal person and who could have a good life ahead. The important thing is the transgender community in different countries is attaching themselves to the right of these people, striving to spread vulgarity and grave sins by mixing the local terminologies. Like, we know that there are some local terminologies everywhere in the native language, which are used for such kind of intersex people. And what transgender community is doing is that they are confusing these terminologies, the local ones, with themselves, and mixing themselves. The transgenders are mixing themselves up with the intersex in the name of human rights, and they're creating confusion among the people, while the original affected people, the intersex people, are still remaining. They are still underprivileged. They are not getting any treatment. They're still working as the beggars, and they're still striving to survive from hand to mouth for their livelihood. So now, in simple term, if I would just explain in you in today's class what are transgender is that when we were talking about the recipe and the the sweet and the curry, when your curry and your sweet dish is finally served on the table in front of your guests, just think that your curry and your halim and your kheer started talking to having a conversation with each other. And the kheer and the halim, which we know are sweet and the savory one, they say that, okay, don't think, the kheer says, don't think I'm sweet. You think I'm sweet, but I'm actually salty. So you know that the sweet dish is sweet, you know the ice cream is sweet. So if you have ice cream and the ice cream says, don't think I'm ice cream, I'm chili garlic sauce. This is what transgender say, right? And let's suppose you have chicken roast. So you have chicken roast, and the chicken roast all of a sudden starts saying, and it looks like chicken roast, it tastes like chicken roast, it has chicken in it, and all of a sudden your chicken roast starts saying, no, don't think I'm chicken roast. I might look like a chicken roast, but I am ice cream. So this is what transgender people say. Don't look at us and don't trust how we look and don't trust at how we sound. We are what we feel like and what we are telling you. So it's just like your ice cream says, no, I'm not ice cream, I'm chili garlic sauce. Right? So this is what transgender people, as we will study in the next class, transgender people are mixing with the intersex people, and they are creating a confusion among the people who do not have knowledge, and they are using this ignorance or confusion in the minds of the local masses, and they are promoting their grave sin in the name of human rights. So this we will definitely study in on our Thursday class, inshallah. So the next problem is that the illegal work industry is making so much money that mostly completely normal individuals also pretend to be part of this group to derive financial and other benefits, which greatly affects moral values in the society. So since the beggary and these all the transgender community is mixing up with the intersex people, and the intersex people are not getting treatment, and they are being taken away by the criminals who castrate them and then put them into the prostitution and dancing at weddings and stuff, the cultural thing. And since all of them are making so much money that even the normal people who are neither transgender nor intersex, they are no one, they're just normal people like you and me, to make money they are becoming part of that league. They're getting into that community just to make money, because these things are highly paid. So this is corrupting the society as a whole. Similarly, if they are not treated, the intersex individuals who could enjoy full Islamic right as a man or woman are deprived of it, such as their proper share inheritance, marriage, rights of ibadah, burial. These are completely destroyed. So if you do not have your rights chalked out or your duties chalked out, how will you become a good human being? How will you become a good Muslim? And how will you, even at the time of burial, how would anyone know that you should be, the shroud should be of a male or a female? How would people bury you? So this is a very important thing, and let's look at the solution. So the first word Allah subhanahu wa ta'ala of Allah subhanahu wa ta'ala that reached to Prophet peace be upon him was Ikra. So Ikra word, I'm not talking about the Ikra Academy, I'm talking about the Ikra word, the first ayah that was revealed to Prophet peace be upon him. The first word was Ikra. Ikra means read, or in broader perspective, it means to obtain knowledge, to seek knowledge. Unlike the Western word which says ignorance is a bliss. The disbelievers have an ideology completely opposite to ours. We say, our Prophet peace be upon him said that seek knowledge from cradle to grave, right? And he said that seeking knowledge is obligatory upon every Muslim man and woman. While the disbelievers, they say that ignorance is a bliss. They like to they want people to be illiterate. They don't want people to know the reality of things, and they are happy because they enjoy the supremacy, or they enjoy their what can I say, rule, by keeping people in the darkness of ignorance. So educate and create awareness among masses. First, educate yourself and then spread that education and that awareness among the masses about this issue versus the transgender differences. So once we're done with this, the next class, you will exactly know what is the difference between intersex and transgender, and educate people. It just be a drop of that awareness in the big ocean. Apparently we think that we are just one, and how will we create or raise awareness, but if you just begin like a drop, it will form a ripple effect. It will eventually reach to people. Explain to people in your circle that treatments for intersex are available and affordable. So if people around us, who god forbid, if somebody has a baby who has this problem, if you just tell them that there are solutions available and don't worry, don't give your child away, at least they will take the child to doctor, the doctor will see, and the child could have a proper treatment and become and he can live a happy normal life. Also avoid the causative factors as much as possible in the pregnancy and shift to organic solutions. So stop going to salons for any XYZ treatments, the getting the keratin treatment done during pregnancy, or the kind of beautification treatments available in the market these days. Pregnant women really love to enjoy these because obviously you are looking very odd and out of shape most of the time in pregnancy. So the women want to look pretty. But problem is that you don't know what they're using, you don't know the ingredients, and the best thing is to stick to the organic solution for the beauty and for the health as well. So similarly, in case of mild issues like cough, flu, cold, instead of taking random over the counter medication, take ginger tea, take honey, and take stuff like that. The eastern again the grannies uh, home remedies. Encourage hospital deliveries, or in case of rural population, deliveries by lady health workers who are trained for handling such problems, so that if god forbid something happens, the doctors or the lady health worker are trained up enough that they will help you guide with it, how to deal with it. They will counsel the parents, they will make them understand that it's not something which is not treatable, it's something that can be fixed, and they just have to be a bit patient and trust in Allah, and the doctors will inshallah fix it to the best of their ability. Similarly, train the daily life interactions to avoid harmful chemicals in pregnancy, such as salons where all sorts of chemical beauty treatments are done without any knowledge of side effects. We know that there are so many treatments being offered at salons, and the girls at salon, they don't know much about it. Even I've met a lot of people who are apparently, they seem to be very educated, but of course they are not educated for biochemistry, they're not educated for the pharmacy ingredients and stuff. So there could be a possibility that they might be not deliberately but unintentionally, they might be missing on to some ingredient which could be harmful for the baby. So avoid unnecessary exposure to chemical, and also the associations under whom these salons are working should also work on training the salon staff or the clinical staff to know the do's and don'ts of procedures on such patients who are pregnant. Okay, now at the government level, government should make policies for filtering out such individuals from the transgender community, because what's happening is that the transgender community is enjoying, the human rights they're talking about. They're enjoying those human rights, and the real intersex are still in the same poor old position. They are not getting any treatment. They are not getting any justice, and they're still the same. So basically, the rich one is becoming more richer, and even in those communities, basically the most of the transgender people are coming from the middle or upper middle class, and the intersex, since most of them are abandoned by their parents because of the shyness or the shame factor and such kind of things, they are struggling with their livelihood. So the intersex people are again settled at the base. They are not uprising, they are not getting any privilege, and the transgender community in the name of intersex is using up all their resources and the name and growing. So the government should make policies for filtering out such individuals from transgender community with the assistance of medical doctors. So medical doctors will actually separate the real one versus fake ones, and then help them get treatment if possible, and help them become a useful part of the society, earning their livelihood with respect and honor. The last point that I want to, this is for all doctors who might be listening to me, is that we as medical professionals should be honest regarding guiding our patients. We should be honest that if there is an intersex person, we have to guide that person to get a hormone or a surgical treatment done to fix his problem. And in case of transgender people, as we will study onwards, we have to guide them for psychological counseling and not for the physical surgical things. So what's happening in the West is that the intersex people are not being guided for, they are discouraged for getting the treatment, and the transgender community is encouraged for getting the surgery done to get their sexual parts removed and to take hormones. So the intersex people are suggested to be like who they are, and they are discouraged to get the treatment, and the transgender ones are encouraged to get the treatment. So it's the other way around. So the doctor should know that who needs physical or who needs psychological treatments, instead of acting like puppets to promote certain hidden agendas. So they should really advise what the patient needs, irrespective of what pressures they have them on them, due to these different, the hidden agendas the world is working on. The last slide has the ayah from Surah Qiyamah, ayah number 39. And Allah, and He made of him two mates, male and female. So now we know, after all this scientific and Islamic study we have done, that Allah has created only two sexes, male and female. The apparently so-called third sex, which is the intersex, is not a separate creation. It's just like any other birth defect. It's kind of a birth defect, which is DSD, development of sexual, it's a disorder of sexual development category, and it's not a third sex. It's basically a birth defect. Just like people born with blind eyes or people born with no limbs, we don't say that there is another category of human beings which is usually normal human beings have two legs, but then there is another category of human beings where they have no legs. So we don't categorize like that. We know that even in case of different factories, each factory has a factory outlet where there are things being sold which have some problem. So similarly, it's not like that humans are made in a factory, but we know that if somebody is blind or if somebody is, handicapped by birth, we don't say that humans are like that. It's just a trial from Allah subhanahu wa ta'ala for those people. So intersex is not a third gender. Intersex is just a trial for those people. And from Allah subhanahu wa ta'ala, sometimes that trial is short. And if you get a treatment, subhanallah, we have scientific treatments available for that. So once you go, you give the treatment to those babies, they are perfectly fine. They're functional as a male or female. They will get married. They will have kids. They will have a normal life. And sometimes, again, it's very rare, but in case of Hunsa Mushkil or the true hermaphrodite, which is the rarest of these all, in that case, that is again just in case of blindness or any other disease. For those individuals, it's a trial from Allah subhanahu wa ta'ala, and they should be patient about it, and inshallah, Allah will reward them for their patience. So this was our class for today. We can quickly take, we have 10-15 minutes for questions if somebody wants to ask something in chat, or unmute the mic and can ask directly. Any questions?
Assalamu alaikum warahmatullahi wabarakatuh.
Walaikum assalam warahmatullahi wabarakatuh.
I just wanted to know, usually a few boys who have slightly developed breasts, but they're normal, but they develop breasts. How is it? Like, how do we treat them, or how do we, is there any treatment for it or something like that?
Yes, may I know your name?
I'm Aisha.
Aisha. Okay, Aisha. Yeah. Aisha, this condition is called gynecomastia in males. So gynecomastia is it's not an abnormality. It's just like a slightly development of breast tissue in males. And the treatment is by surgical reduction of that extra tissue of breast developing. So it's not anything major. It's very common. and simply they can go to a surgery doctor, and ideally a plastic surgeon would be better because he will do the job in a better way. And even from religious point of view, this is permissible, because obviously that's a deformity, and because since it will affect the outlook of a male, so he can simply go both from religious and from the scientific perspective, he can simply visit a plastic surgeon and he can get them reduced.
Okay. And there is no other way out of other than surgery?
No, because the thing is kind of, it's basically extra development of muscle along with skin and tissue. So you cannot reduce it with exercise. Maybe in some cases they can try different, the maybe they can try at gym, because I don't know what might be causing it. They have to visit a doctor and he will tell. Final
Okay.
ultimate treatment is surgery, but maybe they can try
Okay.
at gym different kind of the weightlifting exercises to firm
Yeah.
up the muscles of pectoral muscles. So maybe they
Mhm.
can try that, but they
Okay.
should definitely visit a doctor once and ask him the reason.
Okay. So normal physician would do, or is there any special doctor for it?
The surgery would be done by a surgeon, or I prefer plastic surgeon. But for a normal, just a simple checkup, they can easily go to a GP, general physician, and he will guide for test if he needs to get something done.
Okay.
Yeah.
Okay. Jazakallah khair. Sister.
Vayaki. Any other question? Anyone who wants to ask something, they can write in chat if they're shy to talk. Even you can post me question if you want to ask me something in the WhatsApp group. I'll answer you there. I think there is no question at the moment, so we can wind up our class. I hope today's session was simplified and easy, and I hope you all understood something out of it, if not all. Again, if there are confusions, you can simply text me in the group, and inshallah, as I'll get free, I'll answer your questions. Do spread the knowledge that you got to learn today, and I just pray to Allah subhanahu wa ta'ala that he give us this vision and this knowledge so that we understand the aspects of problems that we are facing from both from Dunya's perspective and from Deen's perspective. And please do pass on this knowledge, because I want this knowledge to be Sadqa Jariyah for us all while we live and after we die, inshallah. So I will again join you, inshallah, on Thursday. Same time, please join the class 15 minutes earlier, because the coming up class is way more interesting than this current session that we did today. So, Jazakallah khair that you all came and you attended the class. And inshallah, we will meet again on Thursday. Till then, take care of yourself and keep spreading the knowledge of Deen, and keep spreading the knowledge of Sharia. Thank you so much. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.